We got to look at my Red Sox, and we got to look at Andrew Bailey. In particular, we want to talk about the ulnar collateral ligament in a thumb and the thumb surgery.
The big thing here with Bailey is it sounds to me like this wasn't an acute injury. It wasn't something that just happened. He didn't fall. And with this kind of injury, there's two versions. There's the gamekeeper's thumb, which is kind of the chronic wear down, which sounds like it's likely what Bailey had. And that's where you can see the ligament here. I got a couple people confused when we said ulnar collateral ligament because that's the same one in the elbow that needs Tommy John. Well, all that means is where the ligament is located. So it's not the same thing as Tommy John. It's in the thumb, and it's on the ulnar side, meaning it's on the side of the ulnar bone. Now, collateral ligament means it helps with side stability. And you can see here, this is a chronic tear. It's gamekeeper's thumb. And what happens is repetitive motion, whether through gripping a baseball or different various hand motions can wear down that ligament and it can get stretched out and eventually tear. That kind of sounds like what's going on with Bailey. They did surgery to repair it. He's out, expected to be out. Earlier reports said 3 to 4 weeks. Now they're saying 4 to 5. I think it's likely somewhere towards the end of 4-5 months for him.
Wow.
It's an extremely problematic injury. We've had guys in the past deal with this injury, but when Chase Utley dealt with it, when he, back in, I believe, 2010, his was an acute injury, meaning it was more like a skier's thumb where the ligament just tears because of a forceful thing. And you can see here, we call it skier's thumb because we see a lot in skiers because they get stuck on their poles and it's forced inward and the ligament tears.
Right.
That, and Utley's not a pitcher. He doesn't need the different various grips like Bailey's going to need to be effective. So it's a big blow for their bullpen. I think they have several options to where they can turn. I think Mark Melancon gets the first crack at it, but it's very unfortunate to see for Bailey. But again, he's one of those guys that for whatever reason can't seem to stay healthy.
Well, and you're right. And all of a sudden, the Red Sox are on the eve of starting their season. They don't have an established closer, and the word is that it is Melancon or Aceves who will get the opportunities to close. Daniel Bard has been given a starting role, and they're not going to mess with that. Let me go back to the thumb. It seems to me you're erring on the side of caution and saying it's going to take longer comparing Utley and others, mainly because this is his pitching hand. It's his throwing thumb. So while another guy might be able to come back quicker, you're talking about a pitcher gripping a ball in this situation, so it's probably going to take longer, right?
Yeah. And, I know we're looking for a sponsor for the Stotts-scope, so I got a little demonstration here. I got my Pringles here. So Pringles, if you're watching.
Oh, this is a natural. This is a natural.
We've got 2 Pringles chips here, and this is similar to how the base of the thumb is. It's a saddle joint, so it's a convex on a concave, and that allows for all that motion at the thumb joint. Okay, that's at your base of your thumb. It's right here. Okay, and you can see how these chips easily glide multiple directions on each other. Okay, now what happens if you tear that ligament is the stability of the thumb itself is compromised, and so you can't come across in opposition, you can't come out in flexion and extension and abduction and adduction because not only of pain but also instability of that ligament tear. So he's going to be out for a while. He's going to need not only time to repair that, rehab that thumb, but he's not going to be able to throw. He's going to have to do some shoulder and elbow, exercises to really repair that area, and that's the problem with him. He's got an injury pass, so you got to tread lightly with him. I've got him in one league, and I'm pretty much counting on him being done for the fantasy year. Like I said, he could return late regular season in playoffs, but I don't know how much that's going to help fantasy owners.